This is a tutorial for a full head-to-toe assessment for LPN students. It will cover neurologic, musculoskeletal, cardiovascular, GI and GU, integumentary, and respiratory systems.
Patient is lying down and no signs of distress noted. Good morning, ma'am. How you doing?
Good, how are you?
I'm excellent. My name is Specialist Ibrahim. Could I real quick get you to verify your name and date of birth for me, please?
Urinal, January 28, 1998.
All right, perfect. Ma'am, do you have any food or drug allergies that you know of?
No.
All right, perfect. Again, I'm going to be your student nurse. We're going to be conducting a head-to-toe assessment, if that's okay.
That's okay.
Perfect. Thank you. All right, ma'am, I just got a couple questions for you.
Okay.
What is today's date?
Today's date is November 1st, 2023.
And why are you here?
I'm here for a physical assessment.
Where are we?
We are in Eisenhower.
Perfect. Thank you, ma'am. All right, ma'am, on a scale of 0 to 10, 0 being absolutely no pain and 10 being the worst pain imaginable, where would you say you fall on that scale?
0.
All right, thank you. We're going to grab your vital signs now.
Okay.
When checking the patient's blood pressure, you want to find the patient's brachial pulse first. Once you find the brachial pulse, you want to align it with the blood pressure cuff's arterial index marker. And when applying the blood pressure cuff, you don't want it to be too tight or too loose. Relax your arm, man.
Okay.
When grabbing the patient's vital signs, you want to make sure that the SpO2 monitor is on the opposite hand of the blood pressure cuff. And when grabbing the temperature, you want to either make sure it's oral, and if not available, axillary. Ma'am, can I see your wrist, please? After the blood pressure, I tell my patients I'm going to be checking their pulse when in reality, I'm checking their respiration rate for either 15 seconds times 4, 30 seconds times 2, or 1 full minute. These are your psychosocial questions. Ma'am, is English your preferred language?
Yes.
And are your cultural and religious needs being met, such as foods you can't eat, prayer times, and or do you need to speak to a chaplain?
Yes, my needs are being met.
Perfect. And do you have a support system at home, such as a spouse, caregiver, or adult children?
Yes, I do.
Thank you, ma'am. Ma'am, are you feeling any numbness, tingling, tremors?
No.
All right, and is there anything I might feel when touching your head?
No.
May you remove your glasses for me, please? And is it all right if I touch you?
Yeah, that's fine.
All right, so we'll start with your head. When assessing the head, you want to check for even hair distribution, as well as feeling the pressure points for any pain. If pain is present on the pressure points, you want to look for any redness or abnormalities on each pressure point. Any pain with that, ma'am?
No.
Perfect, thank you. Ma'am, I see that you wear glasses. Do you happen to wear contacts as well?
No.
All right, and are you experiencing any blurry vision or loss of vision?
No.
Could you stick your hand out for me and touch my pen? Thank you. Just follow the pen with your eyes only.
Okay.
Thank you. After assessing the patient's extraocular movement, you want to move on to PERLA, or pupils equal, round, and reactive to light, and accommodating. All right, ma'am, just look straight forward for me, please.
Okay.
Thank you. After assessing the patient's pupils, you want to verbalize what their pupils were and what they constricted to, as seen on your pen light. Ma'am, are you experiencing any congestion?
No.
So I'm going to cover one of your nostrils, and when I do, please inhale for me, okay?
Okay.
I'm going to do the same thing on the other side. Thank you. No congestion noted. Ma'am, could you tilt your head up for me, please? Thank you. No septal deviation noted, airways patent. This is also a good time to assess the patient's active range of motion on their neck. Ma'am, do you wear any hearing assistive devices?
No.
All right, so I'm just gonna have you turn your head to the right and left for me, please, when I tell you to. So could you please turn your head to the right for me? Okay, thank you. And could you turn your head to the left for me, please? Thank you. So, no hearing impairment noted bilaterally. When the patient moves their head to the right and left, you can also note their active range of motion on their neck. Alright, man, we're going to be checking your auditory functions, so I'm just going to do a hearing test for you real quick. Just tell me which side you hear my fingers rubbing on, okay?
Okay. Right. Left. Both.
Thank you. No hearing impairment noted bilaterally. So when assessing the cardiovascular, you want to pull down the patient's gown and inspect the patient's chest for any incisions, ports, and if they're on telemetry. Then, patient's normally not wearing a shirt with the gown. You want to check their skin turgor. Patient's skin turgor is non-tenting. Then you want to palpate the patient's chest. Did you feel any pain with that, ma'am?
No.
No abnormalities noted.
I will now auscultate for heart sounds, listening for lub dub and S1 and S2. Right of the sternum, second intercostal space is your aortic valve. Second intercostal space on the left side is your pulmonary valve. Third intercostal space on the left side is Erb's point. Fourth intercostal space on the left side is your tricuspid valve. And mid-clavicular line, fifth intercostal space is your mitral valve. When assessing the apical pulse, you want to listen for 1 full minute.
When a male nurse has a female patient, or vice versa, it's always good to have or offer a chaperone to the patient. Alright, ma'am, would you be comfortable lifting up your breast for me while I auscultate your apical pulse?
Okay.
Thank you. When auscultating, you want to listen for a full minute. When moving on to the patient's respiratory system, you want to ask the patient if they have a cough and if it's productive or non-productive. Ma'am, do you have a cough?
No.
Perfect, thank you. Next, you want to listen to their lung sounds. When listening to the lung sounds, you have 6 main points on the front. Here, 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 and 2 on the side. When listening to the lungs, you want to note the lungs' clarity and any abnormal noises, if present. You also want to visualize equal rise and fall of the chest when breathing, and you want to notice if the patient is using any accessory muscles when breathing. When the patient's sitting up, you want to assess their skin integrity. You want to look for any redness or drains. After that, you want to assess their bone structure. Look for any kyphosis, lordosis, or scoliosis if present. Lastly, you have 4 points on the back that you must listen for. You want to find the spine and the scapulus, and you want to listen to the 2 points in between and the last 2 points under the scapula. As part of your respiratory system, you want to note if the patient is wearing a mask, on nasal cannula, or is breathing with room air. When moving on to the musculoskeletal system of the patient, you want to inspect for any IVs, incisions, dressings, and edema. Next, you want to move on to their range of motion. There are 2 types of range of motions. There's active and passive. First, we'll start off with active. Ma'am, could you mimic my movements, please?
Okay.
Stick your arms out for me. Flip them over. Tuck your elbows in. Extend them. Rotate your wrists. And wiggle your fingers. Was there any pain with that?
No.
Thank you, ma'am. Next, we'll be moving on to passive range of motion. Ma'am, could you grab onto my bicep for me?
Okay.
I'll be checking for the patient's shoulder range of motion. Any pain with that, ma'am?
No.
Next, I'll be checking for my patient's elbow range of motion. Any pain with that, ma'am?
No.
As I'm moving down, I'll be checking my patient's skin for her texture, moisture, and temperature. And as I move down some more, I'll be checking for my patient's hair distribution. And then we get down to the wrist. I'll be putting pressure on her bony prominence for any pitting edema. And I'll be rotating her wrist. Any pain with that, ma'am?
No.
Next, I'll move on to her fingers. Any pain with that, ma'am?
No.
While I'm at her fingers, I'll check for any thickening or discoloration on her fingers. And I'll be checking her capillary refills. Then we'll move on to the other hand. Check the same thing, capillary refills. Next, we'll have her do the grip strength. Ma'am, could you squeeze my fingers as hard as you can?
Okay.
Thank you. And again, look for any discoloration or thickening. While you're here, you can check for the patient's radial pulse. Note if the pulse is +1, +2, +3, or +4. Patient's pulse is +3, equal bilateral. Now that you're done with this arm, you can move on to this arm. Move the patient's fingers for them. Any pain with that, ma'am?
No.
Rotate her wrists. Any pain with that, ma'am? Again, feel the bony provenance for any edema. Check the hair distribution. Now, coming to the other side, you want to finish the patient's range of motion. While assessing, you also want to note the patient's skin color and if it's appropriate for the patient. Ma'am, could you grab onto my bicep for me? Any pain with that?
No.
Okay. Any pain with that?
No.
Thank you. Before moving on from the patient's upper extremities, you want to also note if the patient has any bruising, cyanosis, pallor, or jaundice. You want to also inspect the patient for any contractions in the hands or extremity in general, and you want to note if the patient has a cast or a splint on. Now we're moving on to the patient's gastrointestinal and genitourinary system. Ma'am, I have a few questions for you. When was the last time you had a bowel movement?
Yesterday.
And are you on any specific diets?
I'm on a regular diet.
Do you have any intolerances to foods such as lactose?
No.
And are you passing gas normally?
Yes.
And how much of your breakfast would you say you consumed?
I ate 100%.
Alright, and when urinating, do you have any frequency, hesitancy, or pain?
No.
And what color would you say your urine is?
Light yellow.
Light yellow. And do you notice any sediments in your urine?
No.
Any odors?
No.
And would you say your urine is cloudy or clear?
It's clear.
And when utilizing the restroom, do you need a bedside commode or do you just go to the bathroom?
I just go to the bathroom.
Perfect. Ma'am, are you having any abnormal vaginal discharge?
No.
Thank you. When inspecting the patient's GI system, you want to make sure they're lying flat on their bed and normally their abdomen would be exposed. When looking at the abdomen, you want to note if it's flat, sunken, round, or distended. You also want to note if there's any ostomies, incisions, or tubes present. Find your patient's belly button and divide it into 4 quadrants. The right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. Next, you want to listen for your patient's bowel sounds. Make sure you auscultate before you palpate. The normal range for bowel sounds is 4 to 32 in 1 minute. Anything less is hypoactive, anything more is hyperactive, within range is normal active, and if absent, you need to report that immediately. These are the 4 quadrants. The right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. Next, you want to palpate the abdomen. Any pain with that, ma'am?
No.
Thank you. Next, you want to come around on the other side and do the same thing. Make sure it is a light palpation. Any pain with that, ma'am?
No.
Thank you. Ma'am, do you need to use a restroom at this time?
No.
Perfect. When palpating the bladder, you want to find the pubis symphysis bone and apply firm, even pressure on the bladder. Ma'am, did you feel any pain with that?
No.
And no distension was noted. Ma'am, are you feeling any numbness, tingling, or tremors in your lower extremities?
No.
When moving on to the patient's lower extremities, inspect the musculoskeletal system the same way you inspected the upper extremities. Inspect the skin for any incisions, dressings, edema, casts and or splints, and any contractures in the feet or anywhere else in the lower extremity. We will be conducting both active and passive range of motion, same way we did with the upper extremity. Ma'am, could you mimic my movements, please?
Yes.
Kick your leg out for me. Tuck it in. Kick it back out. Rotate your ankles. Wiggle your toes. Could you do the same thing for the other leg? Out. Tuck it in. Kick it back out. Roll your ankles. And wiggle your toes. Did you feel any pain with that?
No.
Thank you, ma'am. Next, we'll move on to passive range of motion. Ma'am, let me move your leg for you.
Okay.
Any pain with that?
No.
As we move down the patient's extremity, we want to inspect the skin for any bruising, cyanosis, pallor, jaundice. We also want to look out for its moisture, texture, and temperature. Any pain with that, ma'am?
No.
As we move down the extremity some more, you want to look out for their hair distribution. Then, you want to feel their bony providence in their ankle and feel it for any pitting edema. Next, we want to rotate their ankle. Any pain with that, ma'am?
No.
You want to feel their toes. Any pain with that, ma'am?
No.
Then, feel one of their digits and look for a capillary refill less than 3 seconds. Then come around to the middle and do the same thing to the other side. Feel the patient's distal pulses. Note if it's +1, 2, 3, or 4. Patient's distal pulses are equal and bilateral +3. Then you want to instruct the patient to push and pull against your hands. Ma'am, can you pull up? Push down. Thank you. You want to note the patient has strength, and that's equal and bilateral. Then, once you're done with this extremity, you'll move on to the other one. Feel their toes. Any pain with that, ma'am?
No.
You want to also note their toenails. Ask them, or look out for any thickening and discoloration. Then, you want to feel their bony prominence in their other extremity. Rotate that as well. Any pain with that, ma'am?
No.
Then, look for their hair distribution. Before moving up, you want to change your gloves. Then, after inspecting the hair distribution, you want to conduct the same range of motion exercise. Any pain with that, ma'am?
No.
Any pain with that, ma'am?
No.
Patient has full, passive range of motion, equal bilaterally. You always want to make sure that the patient's bed is locked and at the lowest position. Ma'am, do you use any assistive ambulatory devices?
No.
Before moving the patient, you want to assess them for orthostatic hypotension, which presents itself as dizziness and lightheadedness when moving from the sitting and standing position. Ma'am, could you sit at the edge of the bed for me, please?
Okay.
Did you feel any dizziness or lightheadedness with that?
No.
Before standing, plant your foot between theirs and have your arms out and at the ready. Ma'am, could you stand up for him, please?
Okay.
You want to assess the patient. Ma'am, did you feel any lightheadedness or dizziness?
No.
Now, we're going to take a couple steps over there and come back to the bed, alright?
Okay.
You want to have your hand at the small of their back as they're walking. And while the patient's walking, you want to assess their gait to see if they favor one side more than the other. Any pain with that, ma'am?
No.
You can sit down. You may lay down as well.
Okay.
Thank you. You want to always make sure that the patient has their side rails up and call bell within reach. Always make sure the patient's items are well within their reach and discuss any discharge planning they may have. Ma'am, you came in for a physical assessment. No abnormalities were found. Keep doing what you're doing.
Okay, I will.
Okay? Thank you so much for letting me conduct this physical assessment on you. Please hit that call bell if you need anything else from me, okay?
Okay, I will. Thank you.
Thank you.